So let's just go a little bit over our agenda today. As mentioned previously, I'm Marvell Adams Jr. I serve as CEO of Caregiver Action Network, and really just want to welcome you to this conversation today. And that's really how we are posing it, because don't feel as if you can't chime in and ask questions, and please take opportunity to share your own perspectives for this intimate group. We're also going to go over families, addiction, and mental health network, what that means, what that is, or FAM as we call it to short, and then our campaign, Take Control of Pain, and going over some of the major components of it, including our own mission and some of the materials, as well as legislative pertinent legislation that may be important for us to be aware of, and then your involvement in this campaign. We'll save some time for questions and a call to action at the end there. But just really glad for everyone that's joined us and happy to get started. So as mentioned earlier, I'm Marvell, and Chance is on there as well. So we won't need to go through that again, but we have lovely headshots, and so we can't help but flash that screen. So just wanted to talk a little bit. So what is FAM? So Families, Addiction, and Mental Health Network. So this was created, CAN led the creation of this network really based upon what we've seen over and over again of a need to focus on the connection between families, family caregivers, and those that support individuals with mental health and substance use disorder. And that's a pretty wide and large scope. But for us, we really recognize that when it comes to caregiving, there really are no bounds when it comes to supporting your loved ones and your chosen family members. And substance abuse and mental health conditions are no exception to that. For us, FAM is all about creating and educating and advocating for policies that can help families that are navigating mental health issues and substance use disorder. And about that campaign that we're going to talk a little bit more about in a little bit, really, it's really about giving the opportunity for us to not only educate individuals out there, individuals and families that are navigating mental health and substance abuse, but also providing education that gives the opportunity for choices in understanding what options may be out there for addressing mental health and substance use disorder. And for today's conversation, we're going to be focusing on pain.
Thanks, Marvell.
And yeah.
Um, so I think for folks on the line, if you're joining us, you're probably aware of the latest kind of transformation in the pain treatment landscape. There have been some interesting and exciting innovations when it comes to how the options that patients and families have in navigating acute pain treatment. So I think the first innovation in 20 years for a non-opioid option, which is really exciting. But I think we're mindful that that really puts folks in a decision-making spot that they haven't necessarily had a choice around in the past. And so supporting organizations like yours in creating resources that may be useful to your constituents to help them navigate this new landscape is really a primary objective and a response to these changes in the treatment landscape.
And so when it comes to, actually creating a pain education campaign, our central focus is around being able to support families and caregivers that are navigating pain management options. And, what comes with that is really having the resources and the education to underpin that. Because, there's aspects of this that are not only inherently difficult to navigate, whether it's from the actual identification of symptoms and perhaps diagnosis of a disorder or need for or condition, to actually finding the correct medications, effective medications, prescription of those, filling those prescriptions, and ensuring compliance with the actual providing those prescriptions to the end user, but understanding that there's a shared decision-making processes as well, and making sure that caregivers and those that they support are a part of that conversation. And we believe strongly that in order to be a part of that conversation, we have to educate individuals on really what those options are out when it comes to pain, and really representing a cross-section of voices, because this isn't really just an issue for one subset of the population, but it really runs across many different areas. Addiction and mental health for certainly is a part of that, but also veterans, whether we're dealing with the outcomes of being in service and pain that may be associated with being hurt or injured in the line of duty, special populations that may have a need for pain control on a longitudinal basis or even short term, seniors and aging for sure, but also just understanding that the pain community itself is a very large part of this education campaign, and knowing that there are additional options that are being made available, but also understanding that regardless of the options that someone may choose or options that they may choose that aren't necessarily prescription based, that the education is really first and foremost what we're focused on for this campaign.
Yeah, and I would just jump in here and share, from a strategic partnership standpoint, there's sort of a range of roles that we believe each organization can play in this important work. When we first began this work, we assembled a steering committee of those who really helped to flesh out the concepts of the campaign. This is very much a growing, evolving effort. And so those of you who have joined today and the others who have signed up, we definitely believe that there is room for your voice to continue to be added to this campaign as it grows and develops. But that initial steering committee that we pulled together included Patient Mind, the Center for Patient Advocacy Leaders, and Black Health Matters. This really ties back to some of those cross-section of populations that we want to ensure are central to this campaign. But as we continue this conversation today, would love to hear your insights about not only the populations you serve and any who may be uniquely or disproportionately impacted, but where you see the biggest opportunities for collaboration and helping us to expand the reach.
So today we're looking forward to going through the two major pillars of the effort. One is focused on education around pain management options and caregiver resources, either that we have in queue for development or hearing from you all about what may be most useful to you and your members. And then the second part of the discussion, which my colleague Tyler will lead, is around advocacy opportunities. So there are different state and federal legislation that can support greater access to innovative treatments in pain management, and we're eager to kind of explore that with all of you. So let's get into it on education. So you've heard a little bit about FAM, and the campaign to educate on pain management as part of that network is Take Control of Pain. So what this is it's our campaign platform, our external educational initiative, how we talk about through our materials this pain education support. So we really see this as a part of FAM. FAM covers a number of topics, but as we think about supporting organizations and individuals in managing acute pain, that's where Take Control of Pain comes in. And what we wanted to express here is really an empowering message that we are enabling, empowering patients, caregivers, and others to navigate this kind of new frontier of conversation, better equip them to really own that path. And as part of that, we are thinking of a cross-channel effort. So as mentioned, there is the campaign website, which if my colleague Caroline can drop into the chat, she can direct you to the page that you see here, which if you haven't, you're please do explore. We have initial resources and language here. You can get to know more about the campaign. But as you can see here as well, we are eager to develop additional assets. So on the right, these are sample social assets that we'd like to work with members to create and make available to all of you for use on your own channels. And the materials can certainly go beyond certain just digital. We have some discussion guides in progress. But again, would love to kind of chat and connect with the team here about what would be most useful to all of you. And we were hopeful, if you wouldn't mind, to do a couple of quick polls. I think here Dakota is going to help us with a poll to get a little bit closer on some of the topics and themes that would be, really of greatest interest if we were going to do a double click on either a special population or a topic for your organization in particular. What might you find most helpful? So you should see that pop up. If you can take a few moments to answer, we would greatly appreciate that input. Okay. Are there any kind of initial points of feedback that can be shared, Dakota?
Yeah, so I just shared the poll results here. Seems like a lot of education and non-opioid treatment options, as well as coming in second. It looks like we have some shared decision making, and it did look like there were some others in there, aging being one of them in the others section.
Great.
But looks like, yeah, this is the spread that we're seeing here.
Great. Well, thank you all for your input here. I definitely want to explore some of those topics in more detail. I think the labor piece is interesting for sure, and the employer piece, we're eager to get a little bit clearer on that, along with the other topics mentioned. Okay. And then we've touched on this already, but just as an overview, the educational materials and resources that we have in mind really sort of center around what you see here. So we're envisioning tailored assets that really speak to some of the unique populations, understanding, as Marvell and Chance set up in the beginning, that acute pain cuts across demographics, health conditions, and so forth. And so there may be unique elements of a conversation that certain key populations may need to navigate that others don't. So we want to work with members to ensure that we're developing the most useful and customizable resources. That goes also for the topics of our webinars. We are eager to host a series of webinars over the course of the year, and we will be doing so. We'll share with you a snapshot of what we have planned so far. But one of the topics, for example, is around shared decision making and exploring how can empower patients and caregivers to navigate acute pain management options with their providers. And then a core component of the effort as well is to ensure that the campaign is developing assets that, again, are most useful to you all, to the advocacy groups that are members or looking to the campaign for educational resources. And so part of that is developing what we call social toolkits. And what those might be are, as I showed in the previous slide, digital assets that your organization can distribute or publish on your own channels as you see fit. So of course, collective input on all of this is what really will make it the most beneficial and useful. And I think we have another poll here to maybe get additional detail and insights from all of you on what types of materials or resources would be most helpful to you in terms of how you support your members on this topic.
I would also just jump in here while folks are doing the poll and say, we're currently in the process of developing some really exciting webinars, which Christina referenced, in particular, one looking at stigma and how to navigate that across the space. The other piece we're looking to activate soon would be one revolving around sort of advocacy how-tos. So how we can activate those caregivers around these particular policy areas and specific activations. So in addition to that, we also have planned an exciting series of blogs, which we would imagine organizations and partners would have opportunities to lend their voice to, which would live and be housed within the FAM network website.
So I'm gonna end the poll here because it seems like all the responses are slow. Oh, there was the last response, I believe. So I'm gonna end the poll now, share the results, and it's looking like a lot of it's coming in at distributing materials like one-pagers and taking part in a webinar, with amplifying social media posts being the next and sharing a blog post being last. Doesn't look like we have any others in this one, but still interesting nonetheless.
Thank you all. All right, well, we're going to move into the advocacy section. Tyler.
Yeah, thank you, and excited to talk about advocacy. I think this is an important piece of this conversation is to make sure that we are hitting our elected officials with our messaging, and this is something that's taking place all across the country. So I wanted to just quickly touch on some state efforts to advance what we're calling pain parity, and that's really addressing the health insurance barriers that people might face when getting access to these newer treatments that are often more expensive than traditional opioids. So you can see here that there is legislation that's been introduced in a majority of the country. Some states like Louisiana and Maine have passed it. The one here, Louisiana, just to give you guys a little bit of a snapshot on what these states are seeking to do, is that it's making sure that they are basically making these treatments available for everyone, certainly special populations that might truly benefit it, certainly in the Medicaid program, to make sure that non-opioids are always considered, and that doing studies, education, and awareness around these new forms of non-opioid painkillers. So this is something that is really the future of health and how we manage our pain. And again, I think for conversation, something that we like to continue to hit home is that people with chronic pain, this isn't, we're not trying to take away people's opioids that rely on it. We're just saying, hey, there are options out there. There are alternatives to true traditional opioids. And that's what states across the country are seeking to do, is just put one more tool in the toolbox to make sure that everyone has what they need. On the federal level, if we go to the next slide, there are a couple of pieces of legislation that we are actively tracking. One that has been introduced in the Senate and the House called the Alternatives to Prevent Addiction in the Nation PAIN Act. And what that does is to increase access for our seniors who are often heavy users of opioids, those that are on multiple medications that metabolize opioids differently, that there are non-opioid pain management options that are considered in their their pharmacy benefit as part of their Medicare Part D program. So that is something that we continue to track, push co-sponsors to in both at the House and Senate, and something that we are optimistic could gain traction later this year. And then there's the second bill referenced here is called the No Pain Act, Non-Opioids to Prevent Addiction in the Nation. It was actually passed in 2024, but we are looking for ways to make sure that that is correctly implemented. We have obviously a new administration that's been in office for about 4 months. There have been a lot of changes at HHS, CMS, so that making sure that this bill that was passed into law in 2024 is not forgotten. And what that does is allow these non-opioid pain alternatives to be accessed in the Part B setting. So in the hospital and ambulatory surgical centers, these are drugs that are administered by doctors that you wouldn't get at the pharmacy. But if you had a knee replacement, you could take these drugs that are long-lasting pain blocks, and then what they call opioid sparing. You then don't have to go on opioids, or you can use less opioids. And I was reading today, that the numbers for the opioid epidemic have dramatically dropped. But I think the asterisk on that is that's great news. That these have dropped upwards of 30%, but that some of these potentially devastating cuts, as we're figuring out, in Congress right now, a budget with the president, that a lot of these programs at the CDC, CMS could, find their way to the scrap heap. So making sure that we don't lose all the ground that we've made in fighting this horrible epidemic. So 2 bills that we are actively tracking. I would ask if there are other federal bills that we might not be aware of that your associations are, following. Please let us know. And then this is how we get success in our advocacy efforts and making sure that these bills are passed or implemented. So, working with you guys to share your story, to sign on to letters, to help us with virtual or in-person advocacy, be that on Capitol Hill or back home, wherever you or your members may reside, helping us capture your story, being an advocate. You can see here at the bottom right, we've done webinars with members of Congress in the past, and Marvell and other thought leaders on this, as well as a conversation guide that we put out for families on how to talk about pain and the alternatives there. So if there are other ways that we can engage with you all that maybe isn't represented here, we certainly want to open that door, and would love to work with you. And then how you can engage yourself with us, very similar to what I just said, but helping us spread our message on these priorities and on these new novel forms of pain management. Help us participate in meetings, review and put input on the resources that we will be putting out, get the materials that we do put out into the hands of the appropriate thought leaders, elected officials on Capitol Hill and in our state houses and senates. Help us write op-eds. There's just so much you can do to help us amplify the content. And I think advocacy is such an important piece of this. I think people are often nervous or afraid to get out and advocate, but there's just so much opportunity there, and that's really what elected officials respond to. I think in this world of so much noise going on, if you can share your personal stories to your elected leaders, that's what really gains the most traction. So helping us tell those tales to those that support our work. So with that, happy to answer any questions on advocacy, and really appreciate everyone's engagement here.
Okay. And I know we've mentioned some of the activities of the campaign previously, and Tyler just touched on a few that we've already kind of soft launched with the Advocacy 101, the Empowered Patients webinar. You can find that in our resources on fam-network.org. We have today's campaign informational, which we will make available to other organizations that maybe weren't able to join today. But here you can see sort of a really high level kind of editorial snapshot of some of the inflection points and assets that we are thinking about, planning to develop throughout the remainder of the year. And this is really where, again, I think your organization's input on what's important to you, to your constituents, sharing some of that feedback with us, I think would really help to sharpen and put a finer point on the campaign and enhance its usefulness to everyone. And so with that, I think we have our final poll, and then we can open it to discussion. But we have our final poll looking to get open-ended insights from all of you around what what would be useful, what you'd like to see, and what you have going on that the campaign might be able to augment or support. Okay. Well, while folks are inputting any additional questions, we'd love to open up the conversation open up the webinar for some conversation about everything we've shared, about any questions that folks on the line have. We'd love to field any questions, provide any more information about CAN or FAM or the campaign based on what we've talked about today. And Chance, you're on mute.
Thank you. Sorry about that. I was also just going to jump in and say, from CAN's perspective, we're looking to launch some of these efforts starting on the 20th this month. And so we'll be sending follow-up materials to everyone here today and to all of those who registered, along with a recording of today's presentation. So if you need to pass that along to other members of your team within your organization, happy to include them as well.
So I wanted to give everyone at least 2 minutes to put in their answers to the poll. So I'm going to, if it's good with everyone, can I end it now? Or I just want to make sure that.
Oh, the poll, yes.
Yes, yes.
Yeah, we should be good with that. Thanks, Dakota.
Okay. So the people who did answer: NFC month supporting caregivers and observance months on social media are the main two things that I see here.
That's great. I think that gives us plenty of opportunities to really find those intersectional areas of interest, particularly as we're talking about and thinking about those priority populations. And, I think even within, if your organization may be focused on a specific disease state or something that may be more patient-centric, I think finding that caregiver or care support angle within some of those opportunities is a great way for us to think about how we expand and grow some of these efforts even further. We're anticipating this being an ongoing effort, and so as we continue to grow and enlist additional partners on the matter, we're happy to field any questions or set up any one-on-one conversations that we need to have moving forward. I think any questions, folks, feel free to come off of mute. If not, we can conclude and be sending out the follow-up materials.
Chance, just to follow up on what you were just speaking about, I don't know if anyone wanted to chat a little bit more about how we do position a lot of those family caregiver perspectives in terms of campaigns like this. I know that a lot of times we often do reach out to our partner groups in disease and condition specific states to say, hey, we really want to leverage a caregiver story here to kind of share their experience. And I didn't know if you wanted to share a little bit more about kind of the process.
Yeah, absolutely. We regularly work with our fellow patient advocacy group organizations to really identify those compelling stories. So whether it's some of the blogs we mentioned as part of this campaign, some of the sort of social media content, even working together to share a byline on a op-ed or letter to the editor or something of that nature. Those are certainly well within the scope of what we're looking to do around some of these efforts. So, as folks work within their network and identify some of these compelling stories, my inbox is open. All of our inboxes are open. So please don't hesitate to reach out about that.